All right, class, let's move on and focus on subacute encephalitis. We just finished up a discussion on acute encephalitis. Encephalitis, to review, is a swelling of the brain. Subacute encephalitis is a mild swelling of the brain as opposed to the acute encephalitis, which is a profound or severe swelling of the brain. Causes of subacute encephalitis include the pathogen Toxoplasma gondii, a persistent measles virus infection, 7 to 15 years after the period of infection, or some prion-based diseases as well. And to review briefly, a prion is a protein-based disease, where the protein itself is the pathogenic agent. So first, let's focus on Toxoplasma gondii. Toxoplasma gondii will cause infection in the fetus and also in immunodeficient people. This infection of the child in utero or in an immunodeficient person is typically going to be severe and is oftentimes fatal. Recent data has shown this infection in otherwise healthy people can have very profound effects on the brain. There are some interesting research articles that were published back in 2014 that talked about how introverted people can act more introverted, extroverted people become more extroverted, and that these individuals that are infected will have more thrill-seeking activities displayed in their lives, and can also be responsible for slower reaction times. But these are very mild cases or mild responses. Some signs and symptoms of Toxoplasma gondii infection include not that much. Generally speaking, the infection is asymptomatic. There'll be some mild symptoms like sore throat, lymph node enlargement, or some low-grade fever. Patients that are on immune suppression, though, are going, due to some other infection, cancers or drugs they're taking, have a very grim outlook. If the patient is immunocompromised, then this infection is going to become much more severe. There can be chronic or subacute encephalitis. This infection is capable of forming extensive lesions within the brain and will often lead to fatal disruptions of both the heart and lung function, particularly if the infection occurs within the brainstem itself. A pregnant woman has a 33% chance of transmitting this infection to her fetus. This is one of the big reasons why men should always make sure to change the litter box for their wives if they have a house cat, because cat feces is a known method for transmitting this virus. Excuse me, not virus, this pathogen. Congenital infection can occur during the first or second trimester, will oftentimes be associated with stillbirth in the child or enlargement of the liver or spleen, hydrocephalus, convulsions, or damage to the retina resulting in blindness for the child. So there's a whole host of nasty symptoms associated with early infection of the child during the pregnancy. This is an obligate intracellular parasite. It has the ability to invade host cells, and this parasite will undergo a sexual phase in the cats and be released into the cat's feces. While this parasite is being released, it can become an infective oocyst and survive in moist soil for several months. The pseudocyst stage is an asexual cyst that forms that can stay in host tissues for extended periods of times. Oocysts can be spread between intermediate hosts like rodents and birds, and the cycle will continue itself when the oocyst gets back into the cat, and that typically results when the cat eats the infected prey. One of the things that was discovered about Toxoplasma gondii is that it's found to also alter the behavioral patterns in rats. It crowds into the part of the rat brain that makes the rat scared of cat urine. And if the rat stops avoiding cat urine, the rat is more likely to hang out in areas where the cat is and is more likely to be eaten by the cat and get back into the cat to continue the life cycle. So when this Toxoplasma infects the rats, they lose their fear of cats and are more likely to be eaten by the cats. Humans are constantly being exposed to this pathogen as well. In serological tests, it's been found that over 90% of the human population has prior exposure to this pathogen. Thankfully, most of us don't have profound effects or diseases caused by this pathogen, so if we are not immunocompromised, generally speaking, we are not going to worry that much about this disease. Sources of infection include raw undercooked meat, unhygienic handling of cat feces, inhalation of dust contaminated with cat feces or cat dropping, or tachyocytes. that can cross the placenta of the fetus to go from mom to baby. Hygiene is one of the best ways to prevent contamination. So make sure that you adequately cook meat, and if you handle cat feces, to wash your hands. We also have prion-based diseases. Proteinaceous infectious particles, or a prion, is a pathogen, so to speak. This is one of those this disease-causing particles. It's not an organism, it's a molecule, and it's smaller than a virus. These disease-causing molecules are known to form transmissible spongiform encephalopathies, or TSEs, within patients. This is a neurodegenerative disease that has a very long incubation period, progression. Human TSEs include Creutzfeldt-Jakob disease and Gertzmann-Strusser-Streicher disease. There are other forms of these diseases that were passed on through generations of headhunters in Papua New Guinea, but when it became illegal to practice cannibalism and headhunting in Papua New Guinea, that disease slowly started to die out. These two versions of the disease, though, still turn up from time to time. We also have some animal-based spongiform encephalopathies. Those can include scrapie, transmissible mink encephalopathy, bovine spongiform encephalopathy, aka mad cow disease, which is also the disease that resulted in most of Britain's beef industry being wiped out in the late 80s, early 90s. Some signs and symptoms of Creutzfeldt-Jakob disease, so this is one of the human spongiform encephalopathies, include altered behavior, memory loss, impaired sensory delirium, or premature senility. These symptoms are consistent with small bits of the brain's nervous tissue, the nervous tissue within the brain, being destroyed, and the brain becomes perforated like a sponge. This progresses with uncontrollable muscle contractions and usually results with death within a year of diagnosis. The causative agent is this prion. It causes a normal host protein to go from its normal state, we'll say PRP, for protein in the normal state, to be changed to the non-normal state. This mutation will cause the protein to be altered, and once the protein is altered, it will move throughout the tissues and alter other similar proteins. The best analogy I can give for you is a zombie outbreak. Once one protein becomes infected, it will move around the tissues, touch other proteins, infect them, and cause them to have the unfavorable conformation. And then those additional proteins will move around the tissues and cause other normal proteins to adopt the unfavorable conformation. These abnormal PRP proteins start a self-propagating chain. The self-propagating chain increases exponentially. So it takes a very long time to get started. But once the wheels get going, once we have a few of these abnormal proteins turn up, they increase exponentially. As they're increasing exponentially, they form plaques in the brain that cause the spongiform damage. These prions are considered transmissible agents. For those of you that are hunters that like to spend time hunting deer and butchering your own meat, generally speaking, in most of Wisconsin, and now in many parts of Minnesota right now, a disease that's affecting the deer population is chronic wasting disease. And it's recommended when processing your animal that you avoid accessing the central nervous system. Don't slice the animal down the spinal cord, don't slice through the brain cavity, only focus on processing the meat and leaving the central nervous system intact. Because there is a small chance that those prions that cause chronic wasting disease in a deer may potentially transmit over to a human and initiate a spongiform encephalopathy within a human being. These prions are very hardy pathogens. They are very, very difficult to get rid of. They're resistant to most forms of sterilization and disinfecting that are used against bacteria and viruses, including prolonged autoclaving at 130 degrees Celsius. Within the late 1990s, it was found that humans that had contracted this Creutzfeldt-Jakob disease did so because they ingested meat from cattle that had been infected with bovine spongiform encephalopathy. Not since then, meat products that are contaminated with any tissues that are infected with the prion need to be destroyed and eliminated. Cases that typically centered around Great Britain, where many cows were found to have bovine spongiform encephalopathy. And this is also one of the reasons why if you were traveling or lived in Great Britain for a prolonged period of time, during this time period, you're no longer able to give blood in the United States because we're worried that there's a chance the prion could go from the patient, the donor, to the recipient. The median age of death of patients that had this version of Creutzfeldt-Jakob disease was 28 years. Median age of death for patients with the other form of Creutzfeldt-Jakob disease is 68 years of age. So the version that comes from eating an infected cow, generally speaking, is going to affect the patient at a much younger age range. Healthcare professionals should be fully aware of the possibility of Creutzfeldt-Jakob disease in patients. Cases have been reported of the transmission of Creutzfeldt-Jakob disease from patients via contaminated surgical instruments to healthcare workers. So if you are a surge technician, this is something that you need to be very aware of. I apparently am tongue-tied today. So the normal disinfecting and sterilization procedures don't prevent the transmission of this agent. It's not enough to wash the equipment, bleach it, and then put it in an autoclave. This prion-based disease can still be transmitted from patient to patient on those instrument surfaces. The latest Center for Disease Control guidelines for handling patients that have Creutzfeldt-Jakob disease in a healthcare provided environment should be consulted. And if I had to guess off the top of my head, I haven't consulted them, but I would venture to say that they would involve throwing away all of the instruments that were used or incinerating the instruments that were used. So let's go back to subacute encephalitis. We talked about 3 things that can cause subacute encephalitis. We had Toxoplasma gondii, we had subacute sclerosing panencephalitis, or we had prion-based diseases. And within those prion-based diseases, for human beings, we had Creutzfeldt-Jakob disease, which goes from human to human, or we could have VCJD, which is a Creutzfeldt-Jakob disease that's contracted by eating contaminated meat. So, concept check question class. True or false? If a husband's wife is pregnant, he should insist on changing the cat's litter box. True or false? If you don't know the answer, you can go ahead and rewind the video and find it, or you can pause it, check your textbook, check your notes, get me an answer. 5, 4, 3, 2, 1. The answer is true. For multiple reasons, the husband should always change the cat's litter box. Number 1, he should hope to minimize his wife's exposure to Toxoplasma gondii. He does not want his spouse being exposed to that pathogen and potentially causing his unborn child to be exposed to that pathogen. Unborn children are at increased risks of severe neurological and physical impairments if they become infected with Toxoplasma gondii while they are in utero. And the second reason is because he should be a gentleman. And when a woman is pregnant, it's really hard on her, and he should take it easy on her and change the litter box because she's dealing with enough stuff already. So that's all we have on this section. If you have any questions for me, feel free to post them to my discussion board or shoot me an email. Happy studies.